In order to fully understand pancreatic cancer and what the purple ribbon means, you first need to understand the pancreas. 6 inches long, the pancreas is located in the digestive system of your body, behind the stomach. The pancreas consists of the head, which is towards the right of your body. There is then the neck, followed by the body, and ends with the tail, which is by the spleen. The pancreas is an endocrine and exocrine gland. The pancreas produces and excretes pancreas juice to help digest food. The juice contains water, salt, bicarbonate, and enzymes. This is the exocrine function. The endocrine function is the production of hormones, including insulin.
There are many risk factors for pancreatic cancer. These include age, gender, race, cigarette smoking, obesity and physical activity, diabetes, chronic pancreatitis, cirrhosis of the liver, occupational exposure, family history, genetic syndromes, stomach problems, diet, coffee, and alcohol. There are also hereditary factors for pancreatic cancer. These factors may account for approximately 5% of the total pancreatic cancer. In fact, there is a 5-year survival rate. The root cause of pancreatic cancer has been studied and characterized very extensively. Specifically, exocrine tumors, the genetic events are as follows: KRAS mutations, 96%, CDKN2A mutations/deletions, 75%, TP53 mutations, 55%, and SWI/SNF mutations/deletions, 35%.
Unfortunately, the symptoms are diverse and generally unalarming. Most symptoms are commonly seen together and are common with non-fatal ailments and diseases. Diarrhea, dark urine, and clay-colored stool are generally symptoms coincidentally common with the flu, but are symptoms of cancer as well. Fatigue and weakness, diabetes, loss of appetite and weight loss, nausea and vomiting, and upper abdominal pain are more general symptoms. So as you can see, when someone has vomiting and diarrhea, one will simply assume they have the flu and will not seek medical attention immediately when they could have dire consequences. Jaundice is a less frequent symptom, but it's not unique to pancreatic cancer or even cancer itself. And jaundice is a yellow tint to the skin, mucousy membranes or whites of the eyes. Usually, if a patient exhibits jaundice along with other pancreatic cancer signs, they will begin to start the diagnosis. There is a structured diet that some pancreatic cancer patients go through during their additional medical treatments. This diet contains antioxidants, flaxseed oil, a limited amount of red meat, fish, red wine, lots of berries, and nuts. They can live a normal, healthy life when they're on this diet for a while, but once they stop, they start to feel more weak and are in and out of the hospital. This diet can help them with the side effects of chemotherapy, which have been known to be difficult and painful. And not only is it recommended that they should eat these foods, but how they eat it is a big help too. So before they eat, a patient should partake in a light exercise, for example, walking, to help stimulate an appetite. When they're eating, they should chew slowly and thoroughly, and then after they eat, they should rest sitting in an upright position for about an hour to avoid heartburn. A loss of an appetite is really quite common in pancreatic cancer patients. Surgeries, prescribed drugs, and sometimes just the cancer itself can cause appetite loss. It's recommended for the patient to have plenty of rest, planning meals with enjoyable and healthy foods and staying hydrated. It can also help to replace a meal with a smoothie or a nutritional drink with fruits and protein, as well as taking anti-nausea medication, and most importantly, portioning out foods on a bigger plate so that it doesn't look as overwhelming for them. This diet can be more understandable if you should see their exact meal plan, 5 to 6 meals throughout the day, and it must include some sort of protein. And they should consume 2.5 cups of fruits and vegetables in addition to their grains and lean protein. It's required to drink lots of fluids like water, Gatorade, juice, and they should drink at least 6 to 8 cups of fluids a day, and that's about 48 to 64 ounces.
Although the prognosis is grim, it is our hope that medical advances for this disease will be made. The only way to improve the outlook of this disease is to help. You can help by volunteering, donating, or aiding in advances. For more information on how you can help, please visit pancan.org.